So what I'm using right now is a scanner. The scanner looks at the electromagnetic fields of the nervous system. So it tells you where the horse is working. It tells you if there's something that might be breaking down. It tells you areas that might indicate that you could use a little help with your saddle fit. It tells you rider imbalance. And it tells you if there's trauma somewhere, whether it's blunt force trauma or a tear that's developing in a ligament or a tendon. And it's pretty easy. You just can look at the whole body all in a cohesive manner instead of just focusing on one thing or that might be an issue that you think is happening. So this is how easy it is. You have a ground, you have a probe, and once you make contact with the skin, the probe tells you where those active nerves are so that you can come back and focus on them when you get to stage 2. So the reason that I'm back here, this is a recheck, is she had some issues in her neck and up in behind the wither. And so we're looking for a resolution to put her in a little bit more actively riding pattern than she had when I was here the last time. The wonderful thing that I'm looking for is there's a biomechanic pattern that comes up when the horse is using themselves at their optimum capability. So I'm going to just be quiet here for just a second because that particular pattern is showing up. This mare has been waiting to see how well she healed from the last therapy session that we did and only has had hand walking. So I'm going to be able to show you the perfect pattern in just a second. Hold on, sweetie girl. Easy. Okay, so when you're looking at developing a top line, what you want to see is lift, which you see in this pattern. Here, how deep into the back is she lifting her back, rounding, and driving all 3 parts of the hamstring muscle. The semimembranosus, the semitendinosus, and the bicep on the outside, coiling those joints to lift herself forward all the way to the hock through the gaskin here. So this pattern shows absolutely no saddle or tack interference and no dragging forward to speak of. This is strongly resolved in the issue that she had before, so this doesn't really count right now. If all of these things are happening, they can correctly lift the front leg and place it instead of having any sort of impingement here behind the scapula that would cause them to drop the shoulder and just swing it forward to get their stride. And of course, that tips even more pressure from the back in self-carriage. If they're not doing it, they fall onto the forehand and they go, instead of 60-40, they could be 70-80% of weight on the front end instead of leaning back and lifting themselves forward. So this is a perfect biomechanic pattern. So one of the things that I'm looking for, because this is a recheck, is there was an extreme amount of activity here in the front of the shoulder on the other side. So I'm going to be switching sides and looking at that to see what kind of resolution we have. There we go. Okay, so of particular interest to me is whether or not the horses have a pattern that's similar or as close to the same as possible on both sides. So if you compared what was going on that side to what's going on this side, you see that there's a little bit more activity here in the TMJ than there was on the other side. Okay, so now we go here down the neck. And all of the activity that we had, which I have on my phone, if you can record off of my phone, you can see that it's nicely diminished. In the front of the shoulder, still have some activity here behind the shoulder. Okay, and so to confirm that this is actually something that might be something that I could look at and be more concerned about, is instead of having that nice lift pattern throughout the whole leg, there's some blank spaces in here where she's not really fully engaging that front limb to lift this leg. So this right here is saying, I don't want to lift that all the way. I'm going to use what I have, but I'm not going to get the full amount of use that she's getting on the other side. Let me see here. Then we want to look at the pectorals, which are the main muscle of forward movement for the front legs. And this is a nice pattern right there. Shows that she's using them, but not overusing them. In other words, she's not pulling herself along. She's driving herself along. Always good to see. So the other thing that I'm looking for in how she's lifting her back is how close to the same is she side to side. So when she's, or any horse, is actually lifting their back, what you see is some nice articulation in the SI. So let's see if that comes up here. There's this. There we are right there. Nice work in the back. Clear here over the shoulder and wither. If there was a saddle fit issue, there might be something right in here that was pressing that scapula forward, which she's not been ridden recently. So okay, big girl. It's a little personal on this side. Gotta kind of get in there. Okay, here's a little something that's left over from the issue that she had right here at the attachment. So because this is here, I can be expecting that perhaps there might not be quite as good a use of the hamstring area as on the other side. So let's see if that is truly the case. Okay, there's a little area of spasm. And just to give you perspective, looking here, and I'll mark these a little bit more clearly so that you can see that you can see the complete use of the hamstring on this side and the clean use all the way to the hock. This side, spasm here, not much use here, spasm here, not much complete use on this diagonal. So that's her pattern. That's what I'm going to be working on to see if I can clear this up. Usually I can resolve about 90%. And the reason I do a recheck is to make sure that 90% stays gone. If it isn't, then I work on what's left. I have a broad spectrum of things that I can apply. The oldest methodology that I have been employing for over 35 years is red light. So I use visible red and infrared. These pads are just a saturation of the whole entire area. They're not as specific. But when I use the cluster light, I go 1 point at a time. And included in that, which is a more recent addition, is random vibrational sound. And as you might recognize, sound is the up and coming cutting edge of healing right now. So I was asked to do a product testing based on the scanner from this company and found that the resolution of the issues that I found was superior to almost anything else I could use, except for red light, which is about the same, about 90% resolution. I also use PEMF. I use straight magnets. I use the Masterson method at the same time that I'm using these. I will use the intention that they advocate for Masterson or Reiki. It's very similar. And I use that whole combination of things depending on where the issues are. So that's my...
When would you choose to use sound versus the infrared light?
I use them together.
Okay.
I use them together because they're both good, but when you use them at the same time, you get a multi-level impact. Visible red is quite a diffused beam, about the size for each one of these LEDs. It's about the size of a quarter. Or even a 50-cent piece, about this big. But the penetration is very, very limited. So you're just looking at photopuncture, basically addressing the nerve endings that are available to you on that shallow level. If you incorporate infrared, it's a penetration beam of about the size of your pointer finger, but it's much deeper. So you've got two levels that you impact. If you add sound, and sound only, sound vibrates into the deep tissue in a way that lights don't. They depend on the nervous system for their impact. So sound, you actually have something that's going into the muscle and goes very deep. If you add the vibrational quality, and it's very mild in this particular unit, you have something that's resonating right into the deep areas of the body when you have the vibration and the sound together, it loosens it, allows the body to let go of the tension that it's holding in that muscle structure. And so this gives you another multi-level of impact. So you've actually got 4 levels of impact when you use this combination. And if you use them together, there appears to be a 5th level of resolution that only happens when you do use them together. And it's similar to the PEMF. If you use just the cluster of PEMF on the spots that you have available, it's different than using a straight magnetic force that just is a magnetic piece, which is very helpful in attendance. I read a study, and it's been decades ago, that they found that when you're healing something like post-op or a post-tear or something along that line, that the cells just randomly fill the hole. But if you use magnets at the same time, the cells tend to line up more in that energy field that you see when you see a magnet, positive to negative. You're probably familiar with that, almost like a figure 8 of how that energy field goes from negative to positive. And the cells have a tendency to line up, which gives you a greater flexibility, especially in a ligament or a tendon when you healed it, instead of just randomly closing the tear or the hole that was made during surgery. So that's, I learned that one down at the racetrack because that's what they have, is lots of tendon problems down there. So that's the whole thing that I do. And the other thing that I offer is the ability to find how your tack is working in conjunction with movement. I can help you have a better pattern of compatibility with the static and the dynamic of the horse and the tag that you're using. And so maybe at some point we could do a saddle fit.
Yep.
So
Awesome. Well, thank you, Donis.